So this video is made to help you understand heart failure in the easiest way within a short time. The video is made with outline to help you while preparing for exams in essay format. If you're yet to subscribe to my channel, please go ahead and click on the subscribe button. Make sure you turn on the notification bell so that you will get updated each time I release my videos. Thank you. By introduction, heart failure is a pathophysiological condition in which impaired cardiac function makes the heart unable to pump sufficient blood required to maintain metabolic needs of tissues, or is able to do so only with an increased venous return to the heart. In this diagram, you can see an affected heart with an impaired cardiac output. However, a failed heart with an increased venous return will be able to pump out sufficient amount of blood. Etiology: it can be due to an intrinsic pump failure, commonly precipitated by conditions like ischemic heart disease, also known as coronary artery disease, myocarditis, cardiomyopathy, metabolic disorders like beriberi. Disorders of the heart rhythm, example, atrial fibrillation or flutter. The second cause is increased workload. An increase in mechanical load will lead to increased myocardial demand, which will lead to consequent myocardial failure. Conditions that lead to increased mechanical load by causing increased pressure load includes systemic and pulmonary arterial hypertension, valvular diseases, example, aortic stenosis, pulmonary stenosis, and mitral stenosis. Chronic lung diseases also causes it. Myocardial failure due to increased volume load is precipitated by valvular insufficiency, severe anemia, thyrotoxicosis, arteriovenous shunt, etc. Thirdly, heart failure can be caused by conditions that causes impaired filling of the cardiac chambers. Reduced venous return to the heart via the superior and inferior vena cava will cause reduced cardiac output, making the heart to fail. Heart conditions that can cause impaired filling of the cardiac chambers include cardiac tamponade and constrictive pericarditis. What are the various types of heart failure? Heart failure can be acute or chronic, left-sided or right-sided heart failure, backward and forward failure. Acute heart failure. This involves sudden and rapid development of heart failure. Conditions that can cause it include large myocardial infarction, valve rupture, cardiac tamponade, massive pulmonary embolism, acute viral myocarditis, acute bacterial toxemia. In chronic, there is slow development of heart failure. Following conditions can cause it: myocardial ischemia from coronary artery disease, multivalvular heart disease, systemic arterial hypertension, chronic lung disease leading to hypoxia and pulmonary hypertension, progression of acute to chronic heart failure. In acute, there is sudden reduction in cardiac output leading to systemic hypotension, cardiogenic shock, cerebral hypoxia. There is no edema. In chronic, compensatory mechanisms try to make adjustments so as to maintain adequate cardiac output, resulting in maintained blood pressure. There is usually edema. Next is the left and right-sided heart failure. For the left-sided heart failure, it is initiated by stress to the left part of the heart. The following conditions can cause it: systemic hypertension, mitral or aortic valve disease or stenosis, ischemic disease of the heart, myocardial diseases like cardiomyopathies, myocarditis, restrictive pericarditis. Next, we'll be talking about the pathological changes in left-sided heart failure. So in the lungs, there is accumulation of fluid upstream, leading to pulmonary congestion, edema, dyspnea, and orthopnea. There is reduced cardiac output, leading to hypoperfusion and reduced oxygenation of tissues, thereby causing necrosis. So in the kidney, there is ischemic acute tubular necrosis. In the brain, there is hypoxic encephalopathy. and the skeletal muscles of such individual will be weak. In right-sided heart failure, there is an upstream to the right heart. It occurs more often as a consequence of left-sided heart failure. Can also be due to pulmonal or intrinsic lung disease, pulmonary or tricuspid valvular disease, pulmonary hypertension secondary to pulmonary thromboembolism, right-sided myocardial disease, congenital heart disease with left to right shunt. Pathological changes in right-sided heart failure. Here there is reduced outflow from the right part of the heart, making the veins and the organs they drain from to become congested. So there is an upstream of the right heart. There is portal venous congestion. There is congestion of the kidney and the spleen. The veins of the neck and the leg are also congested. Hydrothorax and ascites may also be present. Next is backward and forward heart failure. In backward failure, the ventricles fail to eject blood normally. The impaired cardiac output will make pressure to be transmitted backward, causing elevated pressure in the veins. Consequently, this will cause an increase in the pressure and volume of the right atrium and veins. There is also an increase in the end diastolic volume. In forward failure, the heart is unable to pump enough blood, and this will lead to reduced renal perfusion, activation of renin-angiotensin aldosterone system. So next is the compensatory mechanisms. These include compensatory enlargements, which can be cardiac hypertrophy, cardiac dilation, or both. Tachycardia, also known as increased heart rate, may set in due to activation of neurohumoral system. Morphology. On the gross morphology, there is concentric enlargement, which is hypertrophy without dilation, or it could be an eccentric enlargement, which is hypertrophy with dilation. On microscopy, there is increase in size of the muscle fibers, and there is foci of degenerative changes and necrosis.
I hope you enjoyed that wonderful video. Please don't forget to like, comment, and subscribe. Thank you, guys.